During a discrete trial, the RBT gives an instruction, the client responds incorrectly, and the RBT immediately provides the correct model before representing the instruction. What is this teaching strategy called? A. Extinction. B. Error correction. C. Differential reinforcement. D. Task analysis. Answer B. Error correction involves giving immediate corrective feedback following an incorrect response, such as modeling or prompting the correct answer, then giving the client another opportunity. This ensures learning without reinforcing errors. A client consistently asks to leave the table during work tasks. Data show this behavior only occurs when demands are placed. What function does this behavior most likely serve? A. Escape. B. Tangible. C. Sensory. D. Attention. Answer A. If behavior occurs mainly when tasks are introduced, the function is escape. The client is attempting to avoid or delay non-preferred demands, which is distinct from seeking items, tangible, sensory stimulation, or attention. An RBT is teaching a child to request items using a picture exchange system. The RBT starts by requiring only one picture to communicate a request. What is this procedure called? A. Manned training. B. Stimulus fading. C. Prompt fading. D. Shaping. Answer A. Teaching requests, mands, with picture exchange is manned training. The picture is the communication tool, and the skill is learned in a natural context where the item is desired. A parent asks the RBT to also work on math homework during sessions, even though it is not in the treatment plan. What should the RBT do? A. Add the parent's request immediately. B. Inform the supervisor for guidance. C. Refuse to discuss with the parent. D. Create a separate data sheet for math homework. Answer B. The RBT follows the treatment plan developed by the BCBA. Any parent request outside the plan must be directed to the supervisor for assessment and possible inclusion, ensuring ethical and clinical integrity. Which of the following is an example of response generalization? A. Saying dog when seeing a cat. B. Learning to clap hands after seeing another child clap. C. Asking for water by saying water, agua, or H2O. D. Correctly pointing to all pictures of cars in a field of vehicles. Answer C. Response generalization occurs when different but functionally equivalent responses are used to achieve the same outcome, like multiple verbal forms to request water. A client demonstrates a tantrum when denied access to a preferred toy. The RBT blocks access and does not provide the toy, while staying calm and consistent. This is an example of A. Negative punishment. B. Extinction. C. Timeout. D. Overcorrection. Answer B. Extinction occurs when reinforcement is withheld for a previously reinforced behavior. Since the tantrum was maintained by access to the toy, blocking access puts the behavior on extinction. Which of the following best describes a continuous measurement procedure? A. Recording whether a behavior occurred at the end of each interval. B. Counting the number of times a client raises their hand. C. Scoring whether behavior occurred at any point during an interval. D. Estimating behavior duration without exact timing. Answer B. Continuous measurement involves recording every instance of a behavior, such as frequency, duration, or latency. Counting hand raises captures all occurrences, unlike sampling methods. A BCBA instructs the RBT to increase the delay before delivering prompts during training. This strategy is called A. Stimulus shaping. B. Time delay. C. Extinction. D. Behavior momentum. Answer B. Time delay is a prompting procedure where the interval between instruction and prompt is gradually increased, encouraging independent responding. Which of the following is the best example of differential reinforcement of incompatible behavior, DRI? A. Reinforcing a child for asking for help instead of yelling. B. Reinforcing sitting quietly instead of running around. C. Reinforcing hand-raising instead of calling out answers. D. Reinforcing sharing instead of grabbing toys. Answer: B. DRI strengthens a behavior that cannot occur simultaneously with the problem behavior. Sitting quietly is incompatible with running around. The RBT collects data on the amount of time a client spends engaging in self-stimulatory behavior during a session. Which measurement dimension is being used? A. Frequency. B. Latency. C. Duration. D. Rate. Answer: C. Duration measures the total time a behavior occurs. Since the RBT is recording how long self-stimulatory behavior lasted, duration is the correct dimension. A client engages in hand flapping when excited, but it does not interfere with learning. How should the RBT approach this? A. Redirect immediately to stop the behavior. B. Collect data but do not intervene if it is not harmful. C. Punish the client to reduce the behavior. D. Ignore and never record the behavior. Answer: B. An RBT should collect data on all behaviors, even those not interfering with learning. Hand flapping that is not harmful or disruptive may not require direct intervention but should still be monitored for patterns. This helps the supervising BCBA decide whether action is needed. A behavior plan states that a reinforcer should be delivered on a variable interval schedule. What does this mean? A. Reinforcement is given after every response. B. Reinforcement is given after a fixed amount of time. C. Reinforcement is given at unpredictable time intervals. D. Reinforcement is given only when the client requests it. Answer: C. A variable interval schedule delivers reinforcement after unpredictable periods of time, contingent on the occurrence of the target behavior. This makes responding steady and less predictable compared to fixed schedules. When collecting ABC data, the C stands for A. Context. B. Condition. C. Consequence. D. Cue. Answer: C. In ABC data, A stands for antecedent, B for behavior, and C for consequence. The consequence is what happens immediately after the behavior and helps determine the function of the behavior. An RBT notices the client is showing signs of frustration during a session. What is the most appropriate action? A. Stop all demands and allow free play. B. Continue the task without adjustment. C. Provide a short break and return to teaching. D. End the session immediately. Answer: C. Providing a short, structured break helps reduce frustration while still maintaining instructional control. This balances respecting the client's needs with ensuring progress toward treatment goals. Which of the following is an example of differential reinforcement of alternative behavior, DRA? A. Ignoring tantrums and reinforcing silence. B. Reinforcing asking for a toy instead of grabbing it. C. Giving candy every 5 minutes. D. Withholding reinforcement entirely. Answer: B. DRA involves reinforcing a more appropriate or alternative behavior while reducing reinforcement for the problem behavior. Asking for a toy instead of grabbing is an appropriate replacement skill. Which action should an RBT take if a client's parent requests a new strategy not in the plan? A. Immediately try the parent's suggestion. B. Document the request and discuss with the supervisor. C. Politely decline and ignore the request. D. Tell the parent the plan cannot be changed. Answer: B. RBTs must follow the treatment plan written by the BCBA. If a parent suggests something new, the RBT should document and share the information with the supervisor for proper review. A functional behavior assessment is designed to A. Teach new skills directly. B. Identify reinforcers only. C. Determine the function of a behavior. D. Record session length. Answer: C. The purpose of an FBA is to identify the function, reason, behind a behavior, such as attention, escape, access to tangibles, or automatic reinforcement. This guides effective intervention strategies. Which of the following is an example of a conditioned reinforcer? A. Food. B. Water. C. Praise. D. Sleep. Answer: C. Conditioned reinforcers, such as praise, tokens, or money, acquire their reinforcing properties through learning and pairing with primary reinforcers. Unlike food or water, they are not inherently reinforcing. If a client engages in aggression during a session, what should the RBT do first? A. Ensure safety of all individuals involved. B. End the session immediately. C. Restrain the client without authorization. D. Ignore the aggression completely. Answer: A. Safety is always the RBT's top priority. After ensuring safety, the RBT should follow the behavior intervention plan and collect data to report to the supervisor. Which of the following is a key feature of discrete trial training, DTT? A. It relies on natural opportunities only. B. It uses a structured teaching format with clear trials. C. It avoids using reinforcement. D. It does not allow repetition. Answer: B. DTT is a structured method of teaching that breaks skills into small parts, uses clear instructions, prompts, and reinforcement. It allows repeated practice to build mastery. An RBT is asked to run a preference assessment. What is the purpose? A. To punish problem behaviors. B. To identify potential reinforcers. C. To measure baseline data. D. To determine mastery of a skill. Answer: B. Preference assessments help determine what items, activities, or social interactions are reinforcing for the client. These are essential for motivating learning and behavior change. Which example demonstrates continuous measurement? A. Recording the number of tantrums in a day. B. Checking if a behavior occurred at least once. C. Taking note of whether a task was completed. D. Recording how long a tantrum lasts. Answer: D. Continuous measurement involves tracking every instance of a behavior, including duration, latency, or frequency. Recording how long a tantrum lasts is continuous, whereas yes/no recording is discontinuous. What is the best way for an RBT to maintain client confidentiality? A. Discussing cases only with friends. B. Sharing information only with the treatment team. C. Posting progress updates online. D. Telling other clients' families about successes. Answer: B. Client confidentiality is protected under HIPAA and the BACB Code of Ethics. RBTs should only share client information with the treatment team or those directly involved in the client's care. An extinction burst refers to A. A gradual decrease in behavior. B. A sudden temporary increase in behavior when reinforcement stops. C. A permanent elimination of behavior immediately. D. A reinforcement strategy for new skills. Answer: B. Extinction bursts occur when a behavior temporarily increases in frequency or intensity after reinforcement is removed. RBTs must anticipate this and remain consistent with the plan. Which of the following is an example of task analysis? A. Listing the steps of brushing teeth for teaching. B. Reinforcing a client for sitting quietly. C. Ignoring tantrums during transitions. D. Recording session length only. Answer A. Task analysis involves breaking down a complex skill into smaller, teachable steps. This allows systematic instruction and easier learning for clients. During a session, the client begins crying when asked to clean up. What should the RBT do first? A. Offer a break immediately. B. Follow the behavior plan for escape maintained behavior. C. Remove all demands permanently. D. Ignore the crying completely. Answer B. Crying during cleanup may function as escape. The RBT should follow the specific plan in place to address escape-maintained behavior while still encouraging compliance and learning. Which is the most objective behavior definition? A. The client was upset. B. The client screamed for 20 seconds at 75 dB. C. The client was angry at staff. D. The client was non-compliant. Answer B. Objective behavior definitions describe observable, measurable actions without assumptions. Saying screamed for 20 seconds at 75 dB is measurable and unbiased. When a client successfully completes a task independently, the RBT should A. Provide immediate reinforcement. B. Ignore the success to build independence. C. Delay reinforcement until the session ends. D. Ask the parent if reinforcement is allowed. Answer A. Reinforcement should be immediate and contingent on the behavior. Delaying or ignoring reinforcement weakens the learning connection between the skill and the reward. Which of the following is not within the RBT's scope of practice? A. Implementing skill acquisition plans. B. Designing new treatment goals independently. C. Collecting data during sessions. D. Following behavior intervention plans. Answer B. RBTs implement but do not design treatment plans or goals. Creating and adjusting plans is the responsibility of the supervising BCBA. Which of the following is an example of negative reinforcement? A. Giving candy for correct answers. B. Removing a loud noise after a task is completed. C. Ignoring a tantrum. D. Adding a timeout after misbehavior. Answer B. Negative reinforcement strengthens behavior by removing an aversive stimulus, like turning off a loud noise after task completion. This is different from punishment, which reduces behavior.